Welcome to today's presentation on telehealth, brought to you by group number 4 with members Amy Plake, Bree Moses, Lawrence Raymond, and Lucas Renzihausen. What is telehealth? Telehealth is delivery of medical services, education of providers and consumers, and dispensing of medical information via the use of telecommunications. It's often used interchangeably with telemedicine, but its primary objective is to deliver medical services remotely. Telehealth expanded this definition and evolved into what it means today. 4 ways that telehealth is delivered includes video conferencing, store and forward, remote patient monitoring, and mobile health. Video conferencing is the live two-way interaction between two people using audiovisual technology. Through interactive video systems, patients contact on-call nurses and arrange a live video consultation to address problems. For example, how to change a dressing, give an insulin injection, or to discuss increasing shortness of breath. Video conferencing has advantages and disadvantages. The advantages would be that it saves travel time and cost, encourages more frequent contact, has many applications, allows for timely diagnosis and treatment in remote areas, and the disadvantages would be that it requires a high speed and high resolution capability, can be expensive and cost prohibitive, certain populations may need increased education at the outset, and liability and reimbursement concerns. Store and forward advantages include flexibility to obtain information for review at differing times, efficient use of time for both patient and provider, has many applications, considered low-tech, and appropriate for non-emergent situations. The disadvantages include cost of equipment and training, can delay treatment in emergent situations, certain populations may need individualized training for full benefit, and liability and reimbursement issues. Remote patient monitoring is the collection of health and medical information in one location transmitted to a provider in a different location for use in assessment and treatment decisions. Remote patient monitoring advantages include immediate transmission of data, encourages patient empowerment and self-management of chronic conditions, decreases cost of travel and unnecessary office visits, increased quality of care, and the disadvantages include it may be cost prohibitive and need for training and maintenance of equipment. Then we have mobile health. It's the use of mobile devices to deliver healthcare services and education to patients and providers. It can include other delivery methods of telehealth such as video conferencing, remote monitoring, and store and forward. Mobile health advantages include it can promote healthy behaviors with individualized text messages, reminders, and notifications at optimal times, decrease travel time and cost, health promotion and protection, and disadvantages include patient needs access to equipment to receive benefits, elderly population may have difficulty using mobile devices, and licensing, patient privacy, and liability are concerns. Now we're going to discuss the pros of telehealth, which includes continuity of patient care, enhances patient involvement, can decrease the cost of health care, provide better access for rural areas, increases the quality of care, access to continuing education, increased decision-making support, partnerships between healthcare team members, and better records management. Telehealth allows for the continuity of patient care by transitioning the patient from hospital or healthcare facility to a home, which allows access for clinicians to provide continuity of care. It allows healthcare providers to provide early intervention in case there's been a change since the patient has been discharged. Healthcare providers can also communicate directly with the patient on a regular basis, and it enables patients to voice their concerns to the providers via video conferencing. Telehealth enhances patient involvement in their own care by allowing them able to have access to their medical records and participate in healthcare decisions. Patients are able to have consultations via video with their physicians and help understand their diseases and ask questions about medications. Patients are able to acquire knowledge on how to better take care of themselves, and they can monitor their own health progress. Patients also have the ability to acquire more understanding about tests and the relevance of tests that are being completed. It can decrease the cost of healthcare by providing at-home triage services through televisits with providers, which helps reduce the costs from patients going to emergency rooms or urgent care facilities. Home care monitoring programs are available to make sure patients are compliant with their treatment regimen. Patients with chronic diseases can live at home and receive care for a less comparable cost than those of living in a nursing facility. Correctional facilities reduce costs by providing care from the prison, and then there's no traveling costs. Telehealth provides rural areas with better access to care. Patients are able to communicate with their physicians via webcam. There are no travel costs associated. Rural patients can have access to specialties nationwide, such as teleradiology, teledentistry, or teledermatology. Parents can also connect via video with their children's pediatrician to conduct health exams. Then you have an increase in the quality of care received. Telemonitoring helps to monitor patient health status and relays data directly to the physician, such as weight, blood pressure, glucose levels. Telehealth can also provide real-time emergency consultations. Patients have better access to specialists again, and then patients have reliable access to medical information at their fingertips. Then we have better access to continuing education provided through technology, online programs, virtual care, continuing education workshops, telehealth training programs, self-study videos and material, live telehealth activities, and wikis, podcasts, webinars, and virtual meeting spaces. There is also the ability of increased decision-making support. Physicians can seek advice from healthcare providers nationwide. There's an interoperability for the exchange of healthcare information, and telecommunication technologies create new opportunities to improve training for healthcare providers. You will now have a partnership between healthcare team members. It will allow providers to exchange health information and create partnerships, provide a team-based approach for patient care, more interactions between pharmacists and nurses. Telehealth networks are available to aid and assist in communication, and a virtual medical community allows providers to share information, concepts, ideas, and experiences. It also allows for better records management. You have quick access to medical data via the technology that can be accessed really easily in case of an emergency. You have easier tracking of patient data after it's been collected. Files are able to be accessed anywhere from a computer, laptop, tablet, or even a smartphone, and consumer health applications help store patient information in one secure place. Now we're going to talk about the cons of telehealth. The cons of telehealth include rules and regulations, reimbursement issues, cost of technology and staff resources, lack of approval by healthcare professionals and recipients, and risk to privacy and security. Rules and regulations. A major barrier of the widespread telehealth implementation is state-based licensing. Even with ongoing reforms and the adaptation of various states implementing mutual licensure recognition, several issues still arise related to reimbursement, risk and liability management, and responsibility for confidentiality and records maintenance. There are also reimbursement issues. This is the biggest barrier to creating a sustainable program. There are three major sources for reimbursement, which are Medicare, Medicaid, and commercial insurance. Not all services are covered. Only 39 states have Medicaid reimbursement of some fashion, and 27 states have passed legislation requiring private insurance coverage for telehealth. There's moderate revenue that's generated through consultation fees, and services are recognized as cost avoidance for contributing to health maintenance. Then you have the cost of technology and staff resources. These items tend to be costly. The equipment capable of transmitting appropriate diagnostic imaging, appropriate networking systems, patient assessment monitoring devices, and the staff training needed for implementation. Also, you have to deal with risks to privacy and security. The digital age has significantly increased potential unauthorized access of patient information. Paper records are more physically difficult to access. Patients are also more concerned about the access to their information, especially considering history of mental illness or drug addiction and how providers may use this information. Even with the best safeguards present, such as data encryption, data breaches may occur due to employee negligence, sharing of logins and passwords, and increased dishonesty by the patients who fear the breach in confidentiality. Strategies for successful implementation include recognizing the expectation of the parties involved, acknowledging the worth that space holds, stressing the value that telehealth will bring to care, providing proper education and training, and ensure resource availability. Recognizing expectations of the parties involved. It is important to consider the expectations of the patients, physicians, and nurses. Understanding how healthcare providers and patients perceive telehealth can impact its accessibility and implementation. Even though consumers are often taking advantage of opportunities to share and review health information via online and networking sites, they still have some reservations with sharing personal information through the telehealth setting. With the healthcare consumer in mind, it is important to gauge their readiness to participate in the services. Physicians expect to use technology to create benefits for themselves as well as their patients. Providers want interoperability between data collection and systems and health records. Easy access as well as reliable information is critical. Nurses' expectations, they expect to utilize a telehealth program that is safe and has good quality, but not to have an increase in an already heavy workload. They want to be properly trained and have support of the trainers and technical support. We need to acknowledge the worth that space holds. As far as the physical space, we need to ensure that the provider has the appropriate space for the equipment needed to conduct telehealth services. Also consider the healthcare consumer, and thought needs to be placed into ensuring that the consumer has a proper space to participate in telehealth where there's privacy and comfort. As far as the emotional aspect, it can impede on the connection that is usually felt when a face-to-face visit occurs between a patient and a healthcare provider. The patient and context of the appointment needs to be taken into account when deciding what telehealth delivery format a person is to be able to receive. We need to stress the value that telehealth will bring to healthcare. As far as an effective delivery goes, telehealth's goal is to use scientific knowledge to deliver quality care and to decrease the use of unnecessary services. We want timely care, which is meant to reduce wait times for patients. Patient focus by delivering care that is aimed towards the patient's preferences and needs, and by allowing the patient to be an active participant in their care. As far as safe care goes, we want to help contribute to preventing injury and to providing quality care. Decreasing healthcare inequalities by delivering quality care regardless of race, sex, economic class, or location. We also want it to be efficient. There's a more efficient use of healthcare, reducing time lost on travel and from work, and decreased wasteful use of equipment and supplies. We need to provide proper training and education. Inadequate training of healthcare providers as well as patients and families can negatively impact the acceptance and implementation of telehealth. It is imperative that appropriate training that is clear-cut and thorough is provided to all participating parties. Having a team of users who can positively promote the application and provide continued support and training will help increase the success rate. Now we're going to discuss resource availability. Set the healthcare team up for success by having additional staff members available to lighten the overall load while the facility is in the initial implementation stages. Also, have an adequate technology support for your provider team, patients, and families. Not having the resources needed available can negatively impact the success rate and discourage the healthcare team as well as the patient. Telehealth will increase in the future because there's an increase in telehealth's acceptance. An analysis done by Towers Watson showed that 76% of patients prioritize access to care over the need for human interaction with their providers. There's an increased regulatory emphasis based on decreasing healthcare costs. Telehealth will help reduce healthcare costs by decreasing the visits to emergency rooms and urgent care centers. Hospitals are also turning to telehealth to improve access to care, better care management, and lowering healthcare costs. Higher demands for safe, quality patient care. Telehealth will allow caregivers to follow the patient closely and provide a high level of care even while they're at home. This increase in demand can potentially add pressure to increase reimbursement. We have improved reimbursement acceptance by Medicaid and Medicare, and there currently is legislation in the works to improve the cover services. Providers are becoming more comfortable with video conferencing applications, and advances in technology allow for facilitation of care. New technology and the advancement of electronic devices and applications aid in the ease of access of patient information and overall implementation of care. In closing, telehealth will play a central role in the advances of the healthcare system, but currently still has many obstacles to overcome. Concerns about the safety and security of telehealth can pose as a hindrance to the speed in which this practice is accepted in the healthcare environment. Continuing education will be a key factor in the acceptability of telehealth by the members of the healthcare team and recipients of such service. Telehealth is rapidly advancing and is promising for the future developments in improving healthcare delivery. Thank you for your time.